Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAX. Thank you for joining me in my latest video using the WAXscope. And this is of a patient who I recently saw during a domiciliary visit, a home visit. I don't often perform home visits anymore, but this patient has been on one of my clients for the last decade, bless him, and he actually initially contacted me for hearing aids. Now, I no longer offer hearing aids, haven't been for the last 2.5 years, but this is how I met this patient, and they're still currently wearing hearing aids that I previously prescribed. Over the years, this patient's mobility has really reduced, and they're no longer able to visit the clinic, so I do make the effort to go visit them. And they suffer from bilateral chronic superficial otitis externa, so they don't have inflammation of the ear canal per se or discharge. They just get this chronic shedding of dead skin, and they suffer from itchiness and irritation, and they've used prescribed medication over the years. More recently, they've just been using over-the-counter acetic acid spray to help them. And when this patient's ear gets blocked, particularly their left side, so this is their right ear, if you stay tuned for their left ear. I actually performed their left ear procedure first, but when I was uploading the video, the right one came up before the left, so I'm just doing it in reverse order. But with their left ear, when their ear is blocked, they're not able to physically fully insert the hearing aid, which is a bit unusual. So we often have patients with earwax and they wear hearing aids and they can still fully insert the hearing aid, and that's because of the consistency of the wax. Is typically soft, and of course it can impact it if you are a wax sufferer and you wear hearing aids. But this patient's left ear, the wax is typically so rock solid that the hearing aid is half hanging out the ear. And the main difficulty in this case is that when I visited the patient at their home, they're in an armchair, and as mentioned, their mobility is not as good as it used to be, and they were kind of slouched in a certain position, and there's very little space around me to get fully comfortable. So in their right ear, I was actually standing up, and I think at some points I was having to crouch down to get the right angle. And this is one of the benefits of the WAXscope. So with my iClearScope endoscope, I probably would have managed to do it, but it would have been a lot more tricky, because with an endoscope, you require the endoscope itself to open and dilate the ear canal. So there's a lot more coordination between your left and right hand. With the WAXscope, because you've got a specular, once you've got the specular in, the specular acts as a support mechanism. It stabilizes the device, which then allows me to work off screen. So I wasn't actually at eye level with this patient. With the endoscope, you normally need to be at eye level. So what I mean by that is that your eye line should be in direct line of sight with the opening of the patient's ear canal. But with the WAXscope, the ear was considerably below me. I was standing up, as mentioned, and I was just working off the screen. But everything was really secure in that respect. So I cleaned the right ear. It couldn't be too cute. There was a bit of skin here and there. I managed to remove the majority of it, but because of the way I was positioned, didn't want to over clean the ear. It was not necessary anyway, but I didn't want to accidentally cause any trauma by trying to remove a bit of skin here and there that it would be difficult to access, because in a way the way I was positioned, although for removing the large chunks of wax, it was no problem whatsoever. So this is their left ear. This is the ear that I started off to begin with, and normally, because the wax is so rock solid, I don't perform microsuction in this ear. Normally it's all done by manual instruments because the wax is too dry and hard. But as mentioned, they're recently using acetic acid spray on a regular basis, which has kind of softened this wax. So in a moment, I am going to revert to performing microsuction. In fact, when I first visited the patient. I did have my suction pump in the boot of my car, but I didn't take it out initially because I didn't think I would need it. So I just took the WAXscope and the manual instruments, and the moment I switched over to microsuction, I had to go to the car and get the suction pump out. There's a lot of equipment that we have to carry because it just wasn't for the earwax removal. I was also attended to service and test their hearing aid to make sure they're fine. So there's a lot of equipment that I need to carry with me. So I decided to leave initially the suction pump in the boot. So I'm just using the right angle correct initially, scooping out the more lateral wax. You can probably tell this patient's male. A lot of male patients do, and of a certain age as well. Older male patients tend to have a lot of hairs at the entrance of the ear canal. So these hairs, during our formative or younger years, they're less sensitive to testosterone. But there comes a time in life where these hairs then become sensitive to testosterone, and subsequently the hairs become very thick and more like terminal hair. So you kind of have two types of hairs around our body. You have vellus hairs, which is like those little fine hairs you find on a peach, for example. And then you have terminal hairs, which are a lot thicker and they protrude outwards. So, and you can see they've got a lot of skin here. That white reflection there is dead skin. You get a lot of reflection because of how much keratin there is. So I'm just trying to wriggle it out. I'm going to use some drops in a moment to soften this. Over the years, the ear canal has somewhat collapsed as well. So particularly in this left ear, I'm having to stretch the ear open a lot more. So I'm just trying to get a hold of this skin at the bottom. I'm just giving it a little wriggle. We have to detach this from the canal wall. I'm just rocking it backwards and forwards, trying to separate the skin adhesions. I think this ear was more tricky because of the way the patient was sat. So they've got an armchair and the headrest almost curves around their head, and the left ear was almost facing the back of the chair, so it was a bit more tricky to get access. So I'm just rocking this backwards and forwards, and I think I'm going to introduce some oil now. See, that's changed the consistency considerably. It's going to help loosen the skin adhesions, and I'm going to get a better suction grip. So we're just in the region between the first and second bend. This is an isthmus, a narrowing in the ear canals. We've got two narrowings in the ear canal between the first and second bends and the outer third, and also one a bit deeper in the ear canal, just in front of the eardrum, about 0.5 centimetre away. So I've just managed to remove a big bulk of wax and skin there. I think this is almost hanging out of the patient's ear. The next time I attend, I'll ask the patient's partner who's there to kind of just take a still image of me performing it, so you can see, and obviously I can kind of edit the patient out of the image as well, just so you can see the way we approach this. And of course, although I don't often perform home visits now, a lot of colleagues do, and it's necessary because a lot of patients are in care homes now who suffer from earwax, who wear hearing aids. So if you are a hearing aid wearer and you suffer from wax, you're going to have your wax removed on a more regular basis, because the hearing aid can prevent the natural migration of the wax out of the ear, because it kind of pushes it further in and impacts it. So I'm just trying to get some excess skin away as much as possible. Again, there's going to be some left behind. We're getting some clarinetting there, so I think I stopped. Just going to have a look at the eardrum. So as I said, they do suffer from retraction, predominantly of their left eardrum due to a blocked Eustachian tube, which is again another chronic condition they suffer from. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.